There is a question I ask every patient who sits across from me after a cardiac event. Not about their medications, not about their family history, not about their stress levels. I ask them what they cooked for dinner last week, and the answer, almost every time, tells me more about what happened to their heart than any test result in the file in front of me. I've been in medicine for over 2 decades. I've worked inside hospitals, inside systems designed to respond to cardiac crises. I've had conversations with patients after events that changed their lives permanently. And what I kept seeing, year after year, was something that the system around me was not designed to address. The answer was already there. Before the event, before the surgery, before the prescription, before the emergency room at 2 in the morning. It was in the kitchen. Not in a complicated way. Not requiring a nutritionist or a specialty grocery store or a protocol that takes an hour to follow every day. In the most ordinary, overlooked, completely accessible way. And this is the part that I find genuinely remarkable, and the part that I believe more people over 60 deserve to hear stated plainly. The foods and habits that most directly damage arterial health after 60 are not exotic. They are not hidden. They are sitting in your cupboard right now, and so, in many cases, are the things that can begin to reverse that damage. Today, I want to walk you through 5 specific kitchen strategies. Not tips, not tricks. Strategies that work through documented biological mechanisms to reduce the inflammation that drives high blood pressure, support arterial flexibility, and give the cardiovascular system what it has been asking for, possibly for years. And this is the part most people aren't told. These 5 things don't work despite your medication. They work alongside it. They support what your doctor has prescribed. And in many cases, they make that medication more effective at a lower dose. Stay with me. Because what I'm going to explain in the 3rd strategy, the one involving something most people have had in their pantry for years without understanding what it actually does, is the one that, in my experience, produces the most consistent results and gets the least attention. Let me start at the foundation. Because without this, everything else I tell you today will feel like a list of things to try. With it, it becomes something you understand deeply enough to actually commit to. Here is what is actually happening inside your arteries after 60. Not the simplified version, the real one. Your blood vessels are not passive tubes. They are living tissue. The inner lining of every artery, called the endothelium, is a single cell layer that regulates blood flow, controls blood clotting, manages the passage of nutrients into surrounding tissue, and produces a critical compound called nitric oxide that signals the vessel wall to relax and dilate. When you are young and healthy, that endothelial lining is smooth, responsive, adaptive. Blood flows easily. Pressure is regulated with precision. The vessel expands when demand increases and contracts appropriately when it decreases. What happens over decades, and this is the mechanism that most doctor appointments don't have time to explain, is that the endothelium becomes progressively damaged by a process of chronic low-grade inflammation. Not the inflammation you feel when you sprain an ankle. A silent systemic inflammation driven by diet, by oxidative stress, by the cumulative effect of decades of small insults to the vascular lining. As that lining becomes damaged and inflamed, it loses its ability to produce nitric oxide. Without adequate nitric oxide, blood vessels lose their ability to dilate properly. They become stiff, rigid, like a garden hose that has been left in the sun for too many seasons. It still carries water, but it cannot flex the way it was designed to. And a rigid artery cannot absorb the pressure of the heartbeat the way a flexible one can. So blood pressure rises, not suddenly, slowly, quietly, over years, until the morning when the reading is 20 points higher than it should be, and the appointment results in a prescription. Here is what I want you to understand before we go any further. That process, the inflammation, the endothelial damage, the loss of flexibility, is not irreversible. It is not a cliff you fall off and cannot climb back from. The endothelium has remarkable capacity for recovery when it is given the right conditions. And the most direct way to influence those conditions is through what enters your body 3 times a day. That is what this conversation is about. The first strategy. And I want to approach this one differently than you might expect. Because most people have heard some version of eat more vegetables. What they have not heard is the specific vascular mechanism. What is actually happening inside the body when you do it in a particular way that almost nobody thinks about. The mechanism is called meal sequencing, and it is, in my view, one of the most underestimated cardiovascular interventions available to anyone over 60 with high blood pressure. Here's what actually happens when you sit down to a typical meal and reach for the bread or the rice or the potatoes first. Within minutes, those carbohydrates begin breaking down into glucose and entering the bloodstream. Blood sugar rises rapidly. Your pancreas responds by releasing a surge of insulin, the hormone that signals cells to absorb that glucose. This is normal physiology. But in the context of a cardiovascular system that is already managing some degree of arterial stiffness, that insulin surge carries a specific consequence that most people are never told. Insulin is a vasoconstrictor. When insulin levels spike sharply in the bloodstream, blood vessels respond by tightening, narrowing, increasing vascular resistance. Right there at the dinner table, within 30 minutes of eating a carbohydrate-first meal, your blood pressure is rising, not dramatically, not symptomatically, but measurably, repeatedly, every day. And that repeated daily pressure spike, occurring 3 times a day, every day, for years, is contributing to the cumulative vascular damage we just discussed. Now here is what changes when you eat your vegetables first. The fiber in those vegetables, particularly the soluble fiber found in broccoli, leafy greens, carrots, green beans, does something remarkable when it enters your stomach before carbohydrates arrive. It forms a physical matrix, a mesh that lines the stomach wall and the early sections of the small intestine. And that mesh dramatically slows the rate at which glucose from subsequent food enters the bloodstream. The glucose still comes in, but instead of a rapid spike, you get a slow, gradual rise. The insulin response is blunted. The vasoconstriction is reduced. Blood pressure after the meal is meaningfully lower than it would have been if the same food had been eaten in a different order. This is not theoretical. Multiple clinical studies tracking postprandial, after meal, blood pressure in patients with hypertension have found that meal sequencing alone, with no changes to what is eaten, only the order in which it is eaten, produces measurable reductions in post-meal blood pressure readings. I have seen this in practice. Patients who change nothing else, same foods, same portions, same medications, who simply committed to vegetables first, protein second, carbohydrates last, and who returned to me weeks later with lower evening readings and, in some cases, more stable numbers at their next medical appointment. It sounds too simple. I understand that instinct completely. But the mechanism is not simple at all. It is a precise biological interaction that happens in your digestive system with every meal. You are either working with it or against it 3 times a day for the rest of your life. Tonight, before the rice, before the bread, eat the vegetables on that plate first. Completely. Every bite. Then the protein. Then the carbohydrates. Do it for 3 weeks without changing anything else. Then check your numbers. And if this kind of direct, specific medical information is what you want more of, subscribe to this channel right now. Turn on notifications. Every week I bring you the conversation that the 15-minute appointment doesn't have time for. That is the entire purpose of this channel. Hit subscribe. Let's continue. The second strategy. There is something sitting in most people's pantries that they bought at some point, used twice, and then left on a shelf because they weren't quite sure what to do with it. Apple cider vinegar. I want to explain exactly why this matters for blood pressure, because the popular explanations are almost always incomplete. And incomplete understanding leads to inconsistent use, which leads to no results, which leads to people concluding it doesn't work. Let me explain what actually happens when you take 1 to 2 tablespoons of apple cider vinegar in a full glass of water with a meal. The active compound is acetic acid. And acetic acid has 2 specific effects on the cardiovascular system that are directly relevant to blood pressure in people over 60. The first is its effect on insulin sensitivity. Acetic acid inhibits a specific enzyme, alpha-glucosidase, that breaks down complex carbohydrates in the small intestine. By partially inhibiting this enzyme, acetic acid slows the rate of carbohydrate digestion and the subsequent glucose absorption into the bloodstream. The blood sugar rise after a meal is blunted. The insulin response is proportionally reduced. And as we just discussed, reduced insulin means reduced vasoconstriction, less tightening of the blood vessel walls after eating. This is the same mechanism that some pharmaceutical blood sugar medications use. Acetic acid achieves a milder version of it naturally for a negligible cost, with a favorable safety profile for most adults. The second effect is the one that genuinely captured my attention when I first examined the research carefully. Acetic acid stimulates endothelial production of nitric oxide. Remember nitric oxide, the compound that signals vessel walls to relax and dilate, the compound that becomes depleted as the endothelium becomes damaged and inflamed? Acetic acid, through pathways that involve endothelial nitric oxide synthase, the enzyme responsible for producing nitric oxide, increases the baseline availability of this critical vascular signaling molecule. In practical terms, this means that consistent use of apple cider vinegar with meals is actively working to restore some of the endothelial function that chronic inflammation has been quietly eroding. It is addressing the mechanism, not just the symptom. 1 to 2 tablespoons. A full glass of water, at least 8 ounces, because undiluted acetic acid will damage tooth enamel and can irritate the esophageal lining. Use a straw if you have one. Take it at the beginning of each main meal. One important clinical note: if you have a history of gastroparesis, delayed stomach emptying, or active peptic ulcers, have this conversation with your doctor before starting. And if you are on medications that affect blood sugar, monitor your levels more closely in the first few weeks, as the combined effect may be stronger than either alone. For the majority of people over 60 with no contraindications, this is one of the most straightforward additions to a blood pressure management approach that exists. Give it 3 weeks of consistent daily use before you evaluate it. Not 3 days, 3 weeks. The endothelial effects accumulate over time. The third strategy, this is the one I told you about at the start. The one that is already in most people's kitchens and that almost nobody fully understands. I'm going to ask you to do something before I explain it. I want you to think about what happens to your blood pressure between 10 at night and 6 in the morning. Not what you assume happens. What actually happens. For a healthy cardiovascular system, blood pressure drops during sleep, 10 to 20% below daytime levels. This is called the nocturnal dip. It is not incidental. It is a critical physiological requirement. It is the period during which arterial wall cells undergo repair, inflammatory signals are cleared, and the entire vascular system recovers from the demands of the day. In a significant proportion of people over 60 with high blood pressure, that nocturnal dip is reduced or absent. Some have what cardiologists call a non-dipping pattern, blood pressure that stays elevated through the night. Some have what is called reverse dipping, blood pressure that actually rises during the overnight hours, peaking in the early morning when the cardiovascular system is at its most vulnerable. This matters enormously because the early morning hours, between 2 and 6 a.m., carry the highest concentration of cardiac events in people over 60. The combination of absent nocturnal dipping, reduced arterial flexibility, and the natural cardiovascular activation that occurs as the body prepares to wake creates conditions where arterial stress is highest precisely when compensatory mechanisms are lowest. Now, walnuts, 30 grams, approximately 14 halves, eaten 30 minutes before sleep. Here is why this is specific and why it works. Walnuts are the most concentrated plant source of alpha-linolenic acid, the plant-based omega-3 fatty acid of any common food. They also contain meaningful quantities of melatonin, not in amounts sufficient to sedate you, but in amounts that support the natural nocturnal cardiovascular shift. And they contain L-arginine, the amino acid that serves as the direct precursor to nitric oxide in the endothelium. Taken together, these 3 compounds, omega-3 fatty acids that reduce vascular inflammation, melatonin that supports the normal nocturnal blood pressure reduction, and L-arginine that provides the raw material for nitric oxide production, create a specific pre-sleep vascular environment. Multiple studies examining nighttime blood pressure in patients with hypertension who consumed a regular walnut portion before bed found reductions in nocturnal systolic pressure that were clinically meaningful, not marginal. Clinically meaningful, the kind of reduction that would be considered significant in a pharmaceutical trial. This is where many people make the wrong choice. They either skip the pre-sleep habit entirely because they've never connected nighttime nutrition to nighttime blood pressure, or they eat something that actively works against the nocturnal dip, a heavy snack, something high in refined carbohydrates, something that triggers an insulin response right before the body is trying to enter its repair cycle. 30 grams, 14 halves, 30 minutes before bed. If you have a tree nut allergy, this specific strategy is not appropriate for you. Speak with your doctor about alternatives. Ground flaxseed provides alpha-linolenic acid, and magnesium glycinate taken in the evening provides some of the same vascular relaxation support through a different mechanism. For everyone else, this is one of the most targeted pre-sleep cardiovascular interventions available without a prescription. The research supports it. The mechanism explains why it works. And the practical requirement is 20 seconds and a small handful of walnuts. Let me pause here for a moment because I want to say something directly. I am not standing here telling you that these strategies replace medical care. I want that to be completely unambiguous. If you are on blood pressure medication, you should remain on it unless your doctor specifically advises otherwise based on improving numbers. These strategies work best as part of a complete approach, alongside proper medical supervision, alongside whatever your doctor has prescribed, in open conversation with your healthcare team. What I am telling you is that the information I'm sharing today should be part of that conversation, and in too many cases it isn't. Not because doctors don't care, because the appointment is 15 minutes, the prescription pad is faster than a nutrition discussion, and the system is designed to respond to crises rather than prevent them. You deserve to walk into your next appointment with this information. To be able to ask specifically, given what I am now doing with meal sequencing, apple cider vinegar, pre-sleep walnuts, and what I am about to describe, should we consider monitoring my numbers more frequently? Are there adjustments we should discuss? That conversation is available to you. It requires you to show up having done your part. And that is exactly what this channel exists to support. If you are watching this and you haven't yet subscribed, do it now. Before you continue, because next week there will be another conversation exactly like this one, and the one after that, and the one after that. This is what we do here, every week, for people who deserve more than a rushed appointment. Subscribe, turn on notifications. Let's keep going. The fourth strategy. I want to walk to your kitchen with you for a moment. Not literally, but I want you to think about what is in the cupboard above or beside your stove. What oils are you cooking with? For the majority of people over 60 in this country, the answer is canola oil, soybean oil, sunflower oil, or corn oil. These are the oils that have dominated supermarket shelves and cooking advice for the past 5 decades. They are marketed as heart healthy. They are recommended on the packaging. And they are, in my view, one of the most significant contributors to the chronic vascular inflammation, driving high blood pressure in people over 60. Let me explain why. These oils, what researchers call refined seed oils or polyunsaturated vegetable oils, are extremely high in omega-6 fatty acids. Your body requires some omega-6. That is not in dispute. The problem is the ratio. For most of human evolutionary history, the ratio of omega-6 to omega-3 fatty acids in the diet was approximately 1:1, or at most 4:1. The evidence from multiple large dietary studies suggests that the average person today consumes a ratio closer to 15 to 20:1, 15 to 20 times more omega-6 than omega-3. That extreme imbalance is not neutral. Omega-6 fatty acids, when consumed in this disproportionate quantity, are the primary substrate for pro-inflammatory eicosanoids, signaling molecules that promote and sustain the chronic systemic inflammation we've been discussing throughout this conversation. The same inflammation that stiffens arterial walls, the same inflammation that damages endothelial function, the same inflammation that drives blood pressure higher year after year. And here is the part that most people have never heard explained clearly. These refined seed oils are chemically unstable at cooking temperatures. When you heat canola oil or soybean oil to the temperature required to sauté or fry, the polyunsaturated fatty acids in those oils oxidize. They break down into compounds called aldehydes and lipid peroxides, molecules that are directly toxic to endothelial cells. You cannot see this happening. The food does not look or taste different. But with every meal prepared in these oils, oxidized lipid compounds are entering your bloodstream and contacting the lining of your arteries. The cumulative effect over years is precisely the kind of endothelial damage that drives the arterial stiffening and blood pressure elevation I described at the beginning of this conversation. What should you use instead? For everything that does not require very high heat, salad dressings, light sautéing, drizzling over cooked vegetables, finishing dishes, extra virgin olive oil. Not regular olive oil, extra virgin. The difference is significant. Extra virgin olive oil contains a compound called oleocanthal, a natural phenolic anti-inflammatory that works through the same biochemical pathway as non-steroidal anti-inflammatory medications. It also contains high concentrations of monounsaturated oleic acid, which does not oxidize at moderate cooking temperatures, and which has been shown across decades of research to actively support endothelial function and reduce inflammatory markers in people with cardiovascular disease. For higher heat cooking, situations where you are genuinely searing, roasting at high temperatures or frying, real butter, not margarine, which is manufactured from the same refined seed oils we are trying to eliminate, and which contains trans fats even in formulations that claim to be trans fat-free. Real butter, ideally from grass-fed sources, which contains a meaningfully different fatty acid profile, higher in omega-3, higher in conjugated linoleic acid, and stable at the temperatures required for high-heat cooking. I understand that this recommendation may feel counterintuitive. The message that butter is dangerous and vegetable oils are heart-healthy was pervasive for decades. I heard it throughout my training. But the evidence that emerged from properly designed research over the past 20 years points in a different direction. And having stood inside thousands of chests, having seen the state of arterial walls in people who had followed conventional dietary advice faithfully for decades, I can tell you that the conventional advice was not serving them the way it promised to. Go to your kitchen tonight. Look at what oils are there. When the current bottle runs out, replace it with extra virgin olive oil. That single change, maintained consistently over 3 to 6 months, produces measurable improvements in inflammatory markers and in endothelial function in studies of people over 60 with hypertension. One change, one bottle. Started tonight. The fifth strategy. There is a plant that has been used in traditional medicine across Africa, Central America, the Middle East, and South Asia for centuries. A deep crimson flower with a tart, berry-like flavor, served as tea or cold infusion, known by different names in different cultures. Sorrel in the Caribbean, carcade in Egypt and Sudan, agua de Jamaica across Latin America. Western cardiology spent a long time ignoring it. Then the studies started accumulating, and it became harder to ignore. Hibiscus sabdorifa, dried hibiscus flower, and specifically 3 cups of hibiscus tea per day. Let me explain the mechanism, because this is the part most people aren't told, and it is the reason the effect is so consistent and so clinically significant. Hibiscus flowers contain a high concentration of compounds called anthocyanins, the same class of pigments that give blueberries and red cabbage and beetroot their deep colors, as well as specific organic acids called hibiscus acids. Together, these compounds interact with the renin-angiotensin-aldosterone system, the primary hormonal pathway that regulates blood pressure in the body. Specifically, hibiscus compounds act as natural inhibitors of angiotensin-converting enzyme. ACE inhibitors. You may recognize that term from the class of blood pressure medications that carry the same name: lisinopril, ramipril, enalapril. ACE inhibitors are among the most prescribed antihypertensive medications in the world. They work by blocking the enzyme that converts angiotensin I to angiotensin II, a potent vasoconstrictor. By blocking this conversion, they reduce the signal that tells blood vessels to tighten, and blood pressure falls. Hibiscus does this naturally, not as powerfully as pharmaceutical ACE inhibitors at standard doses, but meaningfully, consistently, and without the persistent dry cough that is one of the most common side effects of pharmaceutical ACE inhibitors, and that causes many patients to stop taking them. A well-designed clinical trial published in a peer-reviewed cardiology journal found that daily hibiscus tea consumption reduced systolic blood pressure by an average of 7 millimeters of mercury in adults with mildly to moderately elevated blood pressure. 7 points. In cardiology, a 7-point reduction in systolic pressure is considered clinically significant. It is the kind of result that changes treatment decisions. 3 cups per day. Hot or cold, The bioactive compounds survive both preparations, minimal or no sugar. Sugar will produce the insulin response and vasoconstriction we've been working to avoid throughout this entire conversation. A small amount of raw honey if you genuinely need sweetness. Steep for 5 to 10 minutes to maximize the release of the active compounds. One important and non-negotiable clinical note. If you are already taking an ACE inhibitor medication, do not add daily hibiscus tea without speaking to your doctor first. You would be combining two ACE-inhibiting mechanisms, one pharmaceutical, one dietary, and the combined effect on blood pressure may be more than intended. The goal is optimal blood pressure, not blood pressure that has dropped too far. Your doctor needs to be part of this decision if you are on ACE inhibitor therapy. For everyone not on this specific medication class, hibiscus tea is one of the most evidence-supported, most accessible, most consistent natural antihypertensive interventions documented in the literature. Morning cup, afternoon cup, evening cup, your arterial walls will respond. Now let me bring everything together. Because 5 strategies, discussed in depth, can start to feel like 5 separate tasks. And I want you to see what I see when I look at these together. These 5 strategies are not 5 different interventions. They are 5 entry points into the same biological process. Meal sequencing blunts, post-meal insulin spikes and reduces the vasoconstriction that follows. Apple cider vinegar deepens that effect and simultaneously stimulates endothelial nitric oxide production. Pre-sleep walnuts support the nocturnal blood pressure dip through anti-inflammatory omega-3s, melatonin, and L-arginine delivered precisely when the body needs them most. Replacing refined seed oils with extra virgin olive oil removes a primary driver of chronic vascular inflammation and replaces it with a documented anti-inflammatory. Hibiscus tea provides natural ACE inhibition, reducing the hormonal signal telling your blood vessels to constrict throughout the day. Every single one of these strategies converges on the same 2 targets, reducing the chronic inflammation that stiffens arteries and restoring endothelial function. The lining's ability to produce nitric oxide and regulate vascular tone. 5 doors, 1 room. And this is the part I find genuinely remarkable after 2 decades of practice. These 5 things are not exotic. They are not expensive. They do not require a specialty pharmacy or a prescription or an appointment. They require a plate of vegetables, a bottle of vinegar, a bag of walnuts, a box of dried flowers, and a different bottle of oil. They are already in many kitchens. They have been sitting there, unrecognized, doing nothing. That changes tonight. I want to ask you something before I close, and I genuinely want your answer in the comments. Which of these 5 strategies did you already know about? And which one surprised you most? Not as a formality, because in my experience, the strategy that surprises someone is usually the one that addresses the mechanism they've been struggling with without knowing it. And when someone reads that comment, sees their own situation reflected in someone else's words, something shifts. Leave it below. It matters more than you might think. Now, before this video closes, I want to say one final thing, and I want it to land. The patient I mentioned at the beginning of this conversation, the one whose kitchen held the answer before the cardiac event, before the surgery, before everything. I have sat with versions of that patient hundreds of times, in hospitals, in follow-up appointments, in conversations that happen too late. And the question that never quite gets asked out loud but that hangs in every one of those conversations is simple. Why didn't I know this sooner? The research was there. The mechanisms were documented. The information existed. But somewhere between the laboratory and the appointment and the kitchen table, it was lost. You are sitting at that table right now, with this information, before it needs to be relevant in a waiting room. That is not a small thing. That is the entire difference. Start with 1. Not all 5 tonight. 1. The one that felt most accessible to you in the last 25 minutes. Commit to it for 3 weeks. Let it become invisible. Let it become simply the way you eat, the way you cook, the way you start your evening. Then add the 2nd. The body is remarkably responsive when it is given the right conditions. Your arterial walls, even after decades of accumulated stress, retain significant capacity for recovery. The endothelium can heal. Inflammatory markers can drop. Blood pressure can move in the right direction. I have seen this, not in theory. In people in their 60s, their 70s, their 80s, who decided it was not too late. It is not too late. Give your heart what it has been asking for, in the most practical, most accessible, most ordinary way available to you. It has been working for you without pause for every minute of your life. It deserves this. Share this video with one person who needs it. One person who checks their blood pressure numbers with concern and has never once connected what is in their kitchen to what is happening in their arteries. That share is 30 seconds. It could mean everything for them. And if you are not yet subscribed to this channel, this is the moment. Every week, a conversation exactly like this one. The information the system doesn't make time for, delivered directly to the people who deserve to have it. Subscribe, turn on notifications, and I will see you in the next one. The doctor may give the recommendation, but the kitchen has always been yours. Take care of yourselves, stay curious, and keep asking the hard questions, every single one of them.